Have you ever heard of the atlas bone? Well, believe it or not, it's actually something that can really have an impact on your health. And that's exactly what we're talking about today with our coastal expert from The Joint Chiropractic, Dr. Whitney Denton. Hi, Dr. Denton. It's great to see you.
It's good to be here.
So, you have to tell me, what is the atlas bone and where is it located?
Okay, so the atlas bone is the top cervical bone in your neck. And it weighs about 2 ounces, and it's actually the stabilization for the skull bone here.
Now, this is something that's really important because it can cause you a lot of problems.
Yes.
If it's out of line.
So if the atlas bone is out of line, then it's going to put pressure on the vertebral artery. The vertebral artery goes through the TP of the atlas, which is the transverse process right here, and it supplies blood to the brain. So if it's out of alignment, then it's going to cause decrease in blood to the brain.
So how do I know if I have symptoms that are from my atlas bone being out of alignment?
Some common symptoms are headache, dizziness, and neck pain. You can also have some pain in your hands and also in your shoulders as well.
But with just a minor adjustment, I mean, it really can change your way of life.
Yes, and the reason being is that the atlas bone is the top cervical bone in the neck, but it can affect the rest of the spine because the spine is like a chain. So if you turn the top, it's going to affect the bottom.
And we're not talking about a one-time headache or a one-time symptom here. It's something like if you specifically have something that's ongoing and it's chronic, then more than likely this is something that you should have checked.
Exactly, yes. Symptoms don't come from nowhere. It's usually due to a past trauma.
So who can benefit from having their atlas checked?
Actually, everyone can benefit from having their atlas checked.
Everyone?
Everyone.
All ages?
All ages. I know as a child at the age of 5, I fell on my face as a gymnast, and it made me have chronic headaches for almost 25 years. And when I got my atlas adjusted, then I no longer have any headaches.
So how long does it take to notice improvements? Is this a one-time examination and a one-time adjustment, or is it good to keep routine care for maintenance? And along with that, how long will we start to notice improvements?
Usually you should notice improvements after the first initial adjustment. Now, we do encourage patients to come in 1 time a week to get their atlas checked, because if it's out of alignment, then it can cause further issues. But initially, you should feel better within the first time getting adjusted.
And so it doesn't hurt.
Exactly.
Because, you know, a lot of people think that coming to the chiropractor, oh, I'm a little scared of that. And so, but this is something that really can change your way of life, and it doesn't hurt.
Exactly. It doesn't hurt, and if you do get scared, there's other options that we adjust you. We use the activator, which is an instrument, and it's very gentle, so you don't have to get the popping and cracking if you don't want it.
So could you give me an example, Dr. Denton, because you've been doing this a while now, have worked with a lot of patients. Can you give me an example of how you've seen this type of care really help someone have a better way of life?
Yes, I actually had a patient came in with their 2-month-old and could not breastfeed. And we had examined her atlas, the baby's atlas, and determined that it was misaligned. So if the atlas is misaligned, then the baby cannot turn their neck a certain way. So it doesn't allow it to latch on to the breast. So we give her adjustment of the atlas, and after the adjustment, she was able to turn her neck and able to breastfeed.
What about at other ages as well?
Well, actually, I'm glad you said that, because there is a big dilemma now going on, is because teenagers love their cell phone. They're always looking down at that cell phone, and we're finding out that arthritis is setting in at a very young age because of always looking at their cell phone, and it's actually called text neck.
Oh, wow, text neck.
Yes.
You're kidding.
No.
But this is something that you can take care of at the Joint Chiropractic, and you can get rid of that.
Exactly, and we can treat all ages because apparently everybody loves a cell phone now.
And Dr. Denton, you've worked with a lot of patients, and I'm sure that has to be a great feeling to see someone walking out of the office with a little more pep in their walk and maybe with the posture. That has to be a great feeling.
It's a very rewarding feeling because I got into chiropractic because chiropractic did wonder for me, and that's what I want to do for my patient is make their day a lot better.
Well, Dr. Denton, thank you so much for coming in today and for providing the information that you did. You guys do a wonderful job at The Joint Chiropractic. It's always great to see you.
Well, thank you, and thanks for having us.
If you'd like more information on The Joint Chiropractic or any of our coastal experts, just go to our coastal experts page. You'll find that at wsav.com.